One voice absent from this healthcare debate is America's young adults. According to the Commonwealth Fund, while young people are only 15% of the population, they make up roughly a third of the 45 million Americans who do not have health insurance. So who's speaking up for this generation? Let's get to the thoughts. Joining me now, Eric Yaverbaum. He's the president of the entertainment social networking site collegeclicktv.com and co-author of Life's Little College Admission Insights, Top Tips from the country's most acclaimed guidance counselors. Andrew Rubin is the vice president of clinical affairs at New York University's Langone Medical Center and the host of Healthcare Connect on Sirius XM Radio Channel 114. And Shelby Holliday, you may recognize her. She's a graduate reporter for UWire, and she was with us yesterday and visiting us very nicely in New York. Good morning, guys. Good to see you.
Morning. Thanks for having us.
All right. Let me start with you, Eric.
Yep.
Why are so many young people not insured?
Well, you're right to point out this is the fastest growing segment of the population, 19 to 29, that does not have health insurance. They should care. But this is the same exact group that Obama courted to get into the White House. So they kind of drank the Obama Kool-Aid before we ever started debating serious issues. So they're going to trust him. That's one reason. Two is because they haven't aged yet. They haven't had the need for health insurance as many of us do as we age. So they're not engaged in the conversation, and they absolutely should be. On the other end of the spectrum, you have the AARP, who is completely engaged in this conversation. Somebody should be stepping up and really being interested in that demographic.
Yeah, I would assume, Shelby, that, look, if you're in that age demographic that we're talking about, you're worried about paying rent, you're worried about paying the bills, just kind of getting by. But we're now starting to see certain universities in this country and certain states, your home state, saying you have to have it. It's required.
You're right. And I also wanted to bring up the point that this demographic, this young demographic, is in trouble because 20%, roughly 20 to 30% of college students are uninsured. And you will see that number increase because parents are losing jobs and families are feeling the pinch. These students are usually, about 2/3 of them are insured under their parents' plans. Well, that number is going to go up if the job market continues to decline. And the biggest problem I see is recent graduates, because according to the Commonwealth Fund, about 35% of recent graduates go without health insurance for at least a year after college. Well, if you do the math, 80% of job-seeking graduates from this May 2009 class are unemployed. So when you're under your parents' insurance, you're usually covered until you're 23 to 25, and if you're a full-time student. If you're not a full-time student and you're over the age of 25, you're on your own. Well, these students aren't finding jobs. If 80% are unemployed, they're not going to be insured under their employer, and they're not going to be insured under their parents. So in my opinion, this is the biggest problem that we have.
What do you think, Andrew?
Well, I think they got it right. I mean, I think I would put it into two categories. One is that they're invincible, or at least they think they're invincible. And when you actually look at the healthcare statistics, most of these uninsured, healthy, I'm going to call them kids, are, stay healthy. It's when you get into trouble where it can be catastrophic. And the other thing is the options that are available for them to buy are really expensive. Most insurance plans it's a state-by-state driven system, and the reality is a lot of states have mandated coverage, so it jacks up the cost of the premiums that they have to pay. A lot of these kids want insurance. They know inherently they should have it, but there's really nothing available for them to buy that they can afford.
You raise a great point, Andrew, which is a one-size-fits-all strategy probably doesn't work for America's youth. What do we do about that?
Well, it's a great question, and it's something that really has to be looked at, because you have to understand what's in the bills that are coming out of Congress right now. The whole concept of health insurance reform is predicated on everybody having insurance, including these, this young population of students. So they're going to have insurance, and what's coming out in the bills is a mandated coverage level for everybody in the country, and they're going to have to buy this plan or certify that they can't afford and get subsidized to have a plan on something they may not really need. So it's going to be expensive for them. It's going to be expensive for the country. So we really have to look at what level of coverage this population segment needs to carry. I think a higher level deductible plan, something that's less expensive, not as much basic preventative care, may be okay for this segment of the population, and it will encourage them to buy into it.
You know, Eric, it's an interesting philosophy. I mean, when we talk about it, we are really talking about a one-size-fits-all for the uninsured, and I understand chronic illnesses are the biggest issue here. But should we be breaking it down into demographics and segmentation, breaking it down a little more specifically so that each of the age classes understands?
Absolutely. Yes, absolutely. That, to me, is completely logical, but it also sort of fits with the way that we're jamming legislation through. These are huge issues. For President Obama, who I did support fully, and still do, to be rushing this process is crazy. We're talking about an entire health overhaul. For the Democrats to say we'll go it alone, that's just dumb. We all need to get in the same room, have some good intellectual friction, come up with some better answers.
You know, Shelby, the costs of health insurance, if you got to pay yourself on a monthly basis, can be really high. I mean, in some cases, people pay $800 to $1,000 a month, at a minimum for an individual.
Yeah. You're right.
How can you afford that coming out of college?
You're exactly right, and many can't, because like I just said, a lot of people are unemployed right now. And I also think that you bring up a great point. Young people are usually called, or they're referred to as young invincibles. They are 23 to 25. You know, they could get sick, but it's probably not likely. I'm not saying they don't need health insurance, but it's not something that they want to be required to have. If somebody tells young people that they have to buy something, in general, they have to buy something, they have to do something, young people don't like to be told what to do. And
but they don't even have enough money to do it.
They don't have enough money to do it.
Retirement.
And it's not that they don't value it. You're exactly right. They do value it. You would be surprised. There was a survey by ehealthinsurance.com that found more than 60% of students would rather move into their parents' homes, move back home, than give up their health insurance. 30% would give up their apartments, like 16% would give up their car to keep their health insurance. So it shows you that they value it, but it's not a necessity, and maybe they can't afford it.
And there's an important point here. Most of these people, as Eric pointed out, voted for Obama. A lot of them did, and helped him get elected. And if you were to talk to them, they would say, yes, health insurance for all of America is a good thing. Actually, I think we all probably agree that health insurance for everybody is a good thing. But the lack of a central voice on the issue allows the conversation to skew towards the older population, which is fine.
The AARP.
AARP,
right.
Or whomever. The AMA, the drug companies, who's ever got a louder, more cohesive voice is going to talk louder. So you don't hear a lot of conversation about what's in the bill. And by the way, what's in the bills may be okay, but there needs to be a conversation, and the younger generation needs to participate in that conversation, because guess what?
Right.
They're going to be the ones who are heavily subsidizing this whole system.
Yeah, but
right.
don't just participate in the conversation. What I've been saying now for months is read the bill, one version of the bill. Understand the facts, not from sound bites, not from what I say, not from what any of us say. Read it yourself. You should be interested.
I agree with you, and I covered a town hall event that was at Ohio State University, and there were a lot of students out there who, yes, they value health insurance, but they're just very,
Uninformed?
I mean, they're uninformed, but they're also just very scared with the amount of debt that we've accumulated in the past year. It's on our generation. It's on our kids, our grandkids. It will be up to us to pay back all of these stimulus plans and auto bailouts and different things that we've been spending. So I think students this is awakening students. I think they're going to start caring about it.
Shelby, your own college loans.
Yeah, we are not in an easy position.
All right. So. Well, guys, a great conversation to be continued, because we'll be talking about this.